If you or someone you know suffer from migraines or neck pain, then you know that you really do try just about anything to get relief. But our next guest says, be careful. There are some unusual treatments available that might not actually work. Dr. Rainer Kramer from AZ Pain Centers is here to explain. Good to see you. So first off, what causes that severe neck pain that so many people suffer from?
Well, what we see is that there's usually a traumatic episode or repetitive trauma involved, a car crash, a sports injury, repetitive daily activities that injure connective tissue, muscles, ligaments, nerves, joints, and they cause an inflammatory response triggering an inflamed nerve and wind up causing, as we see on the image here, causing pain fibers to be stimulated and creating a painful episode that is mediated to the brain.
Yeah, you said car crash. Does it have to be, will we feel the pain immediately or
yeah,
will it be down the
that's
line?
interesting. Sometimes that takes place weeks later, sometimes months later, because the damage creates an inflammatory response that finally irritates a nerve, and then that nociceptive stimulus winds up going to the brain. You have a painful episode and find out it's been due to a traumatic episode and damage to tissue.
Right, so it doesn't have to be immediate.
Okay. It's not immediate.
So
no.
we talked about neck pain. What about migraines? What causes that?
Migraine headaches are kind of interesting. That's an inflammatory response that it winds up with the nerve, and as the image shows, the nerves from the cervical spine and also the trigeminal nerve, which is further up. There are nerves directly around the blood vessels that are triggered by chemicals. And those patients who have chronic migraines have a lower threshold. They have a greater sensitivity to those chemicals. Those chemicals wind up dilating the blood vessels, stimulating the nerves and the pain fibers, creating a painful response.
And so many people who suffer from migraines, Dr. Kramer, they say there's triggers that causes them to have that. What are some of those triggers?
Some of those can be a smell, right? Because smell is actually a nervous impulse that goes to the brain. Could be a chemical, could be a traumatic episode, could be a light, could be a simple thing that just because of those sensitized nerves, those nerves that are already very, very fragile, if you will, and then there's a stimulus and that nerve blows up and winds up in a painful cascade of events.
So what makes AZ Pain Center's approach to our neck pain, to our migraines, what makes you guys different?
Well, the key is finding the source of pain, okay? Eliminating the trigger, eliminating the episode, and then stopping the nerve pain by using either a treatment that is non-steroidal or a low-dose steroidal treatment that reduces that whole painful cycle. If you treat it early, break the cycle, you can eliminate some of the chronic degeneration and deterioration that takes place in the joints and ligaments and soft tissue.
Well, our body naturally produces cortisol, so do you work in conjunction with what we already are producing?
That's a great question. Cortisol is naturally produced by the adrenal gland. You do not want to impede or minimize the effect of the body's natural balance of that very, very important anti-inflammatory medication. Our treatments respect the body's natural healing response and help facilitate a broader and more holistic response.
I know specifically today we're talking about neck pain, we're talking about migraines, but do you treat the whole body?
We do, and one of the great add-ons that we've had over the last year and a half has been adding regenerative medicine, where we're using stem cells and platelet lysate to help the body heal. We believe if you give the body an opportunity to heal, because the body has the innate ability to heal itself, what we're doing is using tools to help that body naturally respond and allow as complete healing as possible.
And your patients, they must be overwhelmed when they get relief.
They are, and we're grateful to have them.
Well, if you're ready to stop suffering, for more information, we encourage you to visit the website azpaincenters.com. You can go there to learn all about the treatment options available to you, or you can call the number on your screen, 480-821-PAIN. AZ Pain Centers accepts most insurance plans, and they have locations statewide. For Tucson, call 520-742-PAIN.